So you know it's working and you know it's worth the money you're spending rather than it's like, who wants AI? Me. What do you want it to do? I don't know. When do you want it? Now.
Help me with hip hop. Let's get it right. Protect your patience. Day and night. Donna and David, the experts on your side. Help me with hip hop. Let's get it right.
All right, Donna. So you know what's harder than adulting?
No, because that's pretty hard.
It is called digital adulting.
Oh,
Yeah. It's hard, man.
Getting adults to do the adult thing with technology. That what you're talking about?
Yeah. It's like, what is the maturity level of your organization when it comes to using IT? Are you still doing the same old crap you were doing when you were 2 years old? Or are you doing the mature thing? What is the maturity level of your IT? We're going to talk about that today. We're going to talk about some barriers to having that maturity level. And then we're going to talk about 9 different areas that you need to look at. And it's all based on a survey that you found. And we'll talk about that now.
Yeah, I just find things. I just stumble on them like, a pop top blew out my flip flop.
Yeah.
Anyway, that's this is the 2025 Most Wired survey.
Yeah.
Yeah. And I'm like, what? I hadn't tracked this one before, but Chime is part of it. So that's how it ended up in my inbox. You remember Chime?
Yeah.
Yeah? You got nothing else? Okay.
No, I don't remember it. It does ring a bell.
Yeah. So it's another one of those health information management executives, something is what it stands for. It's another healthcare organization. And, they do a lot of evaluation policy. They track things. It's if you've never checked them out, go check them out. They've got a lot of cool information, and they participate with our HSCC group. So that lets things land in our inbox from them more often. But this report, it was like them and Klaus and who else? There was somebody else, David. Who else is involved? You haven't read the report. I'm on to you.
Is it the IHI or is that?
Well, the IHI is part of the standards they used. However, the report is doing a massive survey of all of these people in all these different organizations, right? And the massive survey is that trying to understand where we are in being like, everybody's wired, how we are doing in making technology advance healthcare. I'm going to go with that is the... It's the DHMW survey. I know. And you're like, still got nothing.
Yeah, well, I'm guessing MW is most wired. I don't know.
Yeah, it is.
What's the DH?
Digital health. So,
there you go. See, you got half of it.
Yeah. Now, and if you're interested, you can participate in 2026's survey. You just go to the website. We'll have it there, so you can at least find your way around, and you could sign up if you didn't participate. Because the cool thing here is that it's huge. Number one, it's massive. So it
Mhm.
really is trying to, get the pulse, if you will, of what's going on by doing this huge survey. And as part of it, they also kind of give you a score. So you don't pay anything, you just answer the survey, and then through that, it gives you your score, which is kind of cool.
Yeah.
And it's one of those things of you get a score of 1 to 10, but 10 is the ultimate, and not many people are there. So that is essentially the whole mix anyway, is the report, class research, class, I never do how to say that one. But the whole idea is to get you information based on real data, which, I'm a fan of. Is I like making decisions based on data, not just what somebody thinks. And I always want to show you the data, and this is where you can get the data. And that's what I love about it. And it covered, like, they gave us the list of, it's free, open to all healthcare organizations. And in 2025, it included 259 unique acute care organizations, 48,000 ambulatory care clinics, and 18 LTPAC, which is long-term post-acute care organizations. Now, they had United States, Italy, Saudi Arabia, United Arab Emirates, UK, Northern Ireland, and India. So some from all, but it looks like the vast majority are from the US. But they're trying to look at not just how we're doing in the US, but how we're doing, in the big picture,
Mhm.
which is that's what we call data, right?
Yeah. I like the way they
Data.
split it out. Because if you're looking at the, they give you a couple different options, but like I'm looking at the Word document option. And so you can
Mhm.
go through and it's got them broken out into different things, and you can click, yes, no, this is an executive level thing, or it's open, or, NA, which I always love the NA because everybody thinks everything's NA.
Yeah.
If the information is not available at all, then you would put NA. But I do like the fact that it's got just the executive piece of it, because that means if it's a leadership function, then you can mark it as such.
Hmm. Yeah. And so that in itself means that they're looking at, we want people answering this from the highest level of decision makers.
Mm-hmm.
And to be able to, I would think anyway, find their way through, I find it helpful, I guess is the best thing. Find it helpful to evaluate what they're using with these domains. And
Mm-hmm.
it's taken the 9 domains and the 5 pillars of healthcare improvement from a group called IHI, which is where you got that one, the Institute for Healthcare Improvement. Novel name, yes. From our standpoint, though, what we wanted to see is, I mean, I get what they're talking about with the improvement and how they balanced it. What I liked is that they're doing a whole bit on having the understanding that it's not just about what do you have, what have you bought. It's whether or not you're using it, and are you using it effectively. And I guess that's the big thing that why I like it so much is it's actually talking to senior leaders in across the spectrum, small, 25 bed hospital, massive mega health systems, ambulatory care practices that range from 5 to 5,000 physicians, a variety. So now I not only want to know what IT you have in place, but have you actually made it effective in improving these 5 pillars of care?
Mhm.
So the point is, it doesn't mean you own it. It means you're using it well, you're using it consistently, and it produces real results. It actually improves your organization. And so often people don't ever ask that question. You know, we talk about the check the box thing. Well, I'm supposed to have antivirus. Okay, I've got something. Check.
Yeah.
Does it do anything? Never look. So this quintuple aim of the 5 things is improving population health, improving care, advancing health equity, improving workforce well-being, and lowering costs. If we focus
Okay.
on all 5, right? And then this report takes those and says, okay, let's look at the domains of that they want to track to see how healthcare is doing. And they look at 8 domains: the infrastructure, cybersecurity, administration, supply chain, analytics, and data management, which gets me all. Well, can't wait to read that part. The minute it said that, I'm like, I got to go. Interoperability, population health, patient engagement, clinical quality and safety, and innovation and emerging technology, which that means we're talking about AI in there somewhere.
Yep.
So the good news is it's all about we're looking for these common goals and common objectives, whatever you want to look at it, and how are we doing using technology to get there? One
Yeah.
would think
So
it's a good idea.
yeah, kind of like do your own report card kind of thing. It's like, pass your papers to the person beside you and have them grade them.
Yeah, exactly. That's it. I always love that when they would do that.
Yeah,
So
I did
it'd be
too, as long as it
fierce.
was certain people. If it was always that person behind me, I'm like, oh man, don't let them grade my paper.
So, we'll go through all of the different domains and what they see as maturity, but they did have a section at the beginning that I thought it was interesting. The top 3 barriers to IT success. Now, they only covered like 6 because 2 of them you couldn't really quantify this way, I don't think. Out of the 9, they covered first is cybersecurity. So we're going to look at cybersecurity, and then what are the barriers to being successful with excess. Whew.
Yeah,
I'm
these are the
slow.
ones I run into every day.
Yeah.
So one is you got old stuff, so you can't have a mature security posture if you're running old equipment. Hello, Windows 95, XP, 7, 10, you name it. So you got old stuff. The second barrier, and we talk about this a lot, is third-party and supply chain security risk. So you're not
Big
doing
barrier.
anything to help with that. And that's getting worse by the minute.
Yeah.
Because everything connects to everything, and you don't even know who your third-party vendors are most of the time.
Unfortunately.
And then lastly, the financial constraints and budget limitations. So I would say some of these are actual budget limitations and some of these are self-inflicted budget limitations.
Okay, in some ways, yes. Yeah, so just in dealing with and having a mature cybersecurity program, those 3, they consider the top barriers. And then we get to my favorite, analytics and data management. And the top barrier is digital and/or data literacy of end users.
Right. Yeah.
Actually, probably why we exist as a company, right? And our podcast.
Yeah. They're basically saying your end users are ignorant. That's what it's
No,
saying.
I didn't say that. I did not say David said that.
That
I
is
did
what
not
it's
say
saying.
that. Number 2, insufficient technical resources for model validation, which I'm like, okay, based on number 1, number 2, insufficient training and analytics tools. Those 2 contribute and create number 1, because I have that problem and I don't have the other things that'll get me there. So that's huge. All right, what's next?
Interoperability and population health.
Yeah, hit that one because I shot way past it with the mouse.
So the first barrier is community partners lack EHR interoperability. And yeah, that's always a problem when you got 4,000 different EHR vendors out there you're dealing with.
Yeah.
Barrier number 2, mismatch in data standards and formats. Yep. Barrier 3, cost or resource constraints. I'm starting to see this cost thing pop up a lot.
Yeah.
Next domain is patient engagement. So first barrier, care provider time constraint and digital burden. This is why you start to see a lot of people going into direct primary care and concierge and all this kind of stuff because they complain incessantly about not having that care provider time. Barrier number 2, low patient digital health literacy. Yeah. So it's like patients have the ability to use technology to help them manage their own health and all that. They just don't know how to do it. They're not interested in doing it.
Yeah, well, and a lot of times it's not done consistently anywhere and not made easy to follow. So if you don't even know the healthcare terms and you're wandering around in an app, like me, I'm like, doo-dee-doo. I love it. I'm like, why won't you let me do more in the app? But my dad is like, not doing it. Not gonna do it. No. So yeah, definitely the case.
And the last one here, and I think this is the one that probably hits home more, is they have data overload and alert fatigue.
Oh yeah.
So interesting that patients, I always think of alert fatigue as being more of an IT term, not a patient engagement term.
Yeah, I guess, but you think about it, we're trying to constantly tell them stuff and they're like, I don't want to know, so many times I hear that as a response. So.
Yeah.
All right.
Well, even on like our social media, I've kind of cut way back on even talking about data breaches because it's every day.
Yeah.
And now people are like, whatever.
Yeah. We just don't talk about them anymore. Unless it has some other piece of information we can work with, it's just another one, unfortunately.
Yeah.
So.
All right. Clinical quality and safety. So barrier 1, cost and infrastructure constraints for AI. Barrier 2, lack of AI expertise and workforce readiness. And barrier 3, technology maturity and market readiness, or as some people say, AI readiness.
Yeah, it's all, it all blends in there together. It's like, well, we're going to use AI to do all of these amazing things. And so I got one queued up for next week. I think next week or so, we'll talk about people that are like, I'm going to try it. I'm going to go all in on AI and see how it goes. And there's multiple studies are saying not necessarily the way to go. So we're going to talk about how to go. But that is the root issue. We don't have the expertise. And the technology is just not there. And everybody's assuming, well, we're going to be able to replace all these people. Yeah, that's not going to go well in a lot of places. So
no, I really feel AI is more positioned for human enhancement, not human replacement. And if organizations look at it that way, and if people look at it that way, instead of, oh my God, all this, losing our jobs and the robots taking our jobs, whatever, look at it like you need to embrace it so that it enhances your ability to do your job. And as an organization, I'm not looking to replace who I have. I'm looking at equipping them with this new tool, because that's all it is, to do better work faster.
Yes, and more accurate and more, so there's so many areas, and there's, a couple where, there's going to be lack of things for you to do. So you need to learn about how to use the AI to do other things that, are offshoots of what you do. But particularly in healthcare, we have to worry about quality and safety issues. Cyber safety is patient safety.
Mhm.
It's not about compliance, it's about patient care. It's we say it over and over and over, and this concept of throwing AI in there without it being a mature, controlled environment is just, it's terrifying when it comes to quality and safety. So, of the clinical
Yeah.
part, especially.
I was watching this tutorial the other day, and it was talking about vibe coding. If you're not familiar with vibe coding, basically you just use text, like everyday text language. You're texting with the LLM or the AI, and it codes whatever you're wanting it to do. So vibe coding, you don't have to learn code and all that. You just tell it what you want. And so the tutorial was talking about the opportunities for vibe coding certain products and software applications. And healthcare was the first thing that popped up. Like, you can vibe code all these amazing healthcare applications. And I'm like, oh my God.
Oh no. Oh no.
Yeah.
Right away. Yeah. Right away. See, and that when you see that, that it's somebody that doesn't understand the complexity of healthcare. There's a lot that you have to worry about when you get in there. All right. So next is innovation and emerging technologies, which just keeps going the way we've been going. It basically touches everything we just talked about, doesn't it?
Yep. Financial constraints or ROI uncertainty. Number 2, resistance to change and clinical adoption challenges. And number 3, interoperability and legacy system integration. So basically, we just took all the rest of them and pulled them down to that one.
And merge them all together, which is why I was looking at that going, well, I don't think we can do a lot with that, but cover it. But I'm a big fan on the part of maturity. It's one of those things that, I know you're shocked to find out that we do SRAs and those things differently than most, because we track, multiple things. One is, what's the actual risk you face? I don't want you to lose sight of how big that risk is. If I start showing you a report that says you're low risk on a cyber attack or an email compromise, you're going to think you don't have to worry about it. No, I want you to know everybody's high risk on both of those. Let's don't pretend. That is the actual risk we face. Then we look at, what is your plan to handle that risk? What are you going to do? You're going to just pass it on to somebody else? Well, you still have to manage it yourself. You're going to handle it internally. Well, now I've got all the policies and procedures and training and management and all of that I've got to do. Or I'm just not going to do that in my business. And that's so often everybody's like, well, we're just not going to do that then. And I'm like, that's great. And people are like, how do you just avoid it? And I'm like, well, you just don't use computers. There you go. You can do that. Luck. Yeah. But then you take those and how well you're doing at that plan. Do you have contracts in place? Do you have written policies and procedures? Do you have documentation? Do you have people trained that if something goes wrong on that high risk thing, everybody knows what to do? Okay. Well, if you have those things, then there's a maturity level that you can be sure of, because I know I'm looking and I know I have the things in place. I'm not just checking the box. And then that gets me to, what is my residual risk? Because if I have a mature program, so that's the way I've always looked at it. And I see this and I'm like, I love it. So it gives us in each of those domains, as it goes through, it doesn't just say, well, you had to score this or score that. They looked at what makes a mature organization in these domains against those 5 pillars that it talked about. And so in each of the domains, we kind of tried to summarize because it doesn't say these are the things you have to do. It's not a checklist. Go figure.
Yeah.
It's not a checklist. So I wanted to hit on like in a very general term what they're getting at on each of these areas. And no matter what size or type of organization you are, these would apply. It doesn't even, some of it wouldn't even apply, would still apply rather, even if you're not healthcare. So that's why I thought we should go through those. So let's talk about infrastructure.
All right.
So
for low maturity, this is kind of funny because I look at this and I say, I know people that are less than low maturity. So what does that mean? So for low maturity, it would be like you've got the cloud and the connected devices, but everything still relies on manual monitoring and annual disaster testing and single site backups.
Assuming that's even happening.
Right. That's what I'm saying. I know a lot of people that are low up under this. So they're low. Like, how low can you go? Yeah. They're not even doing this stuff good. But anyway, let's look at what high maturity looks like for infrastructure.
Yeah. You don't want to win the limbo contest on this, right?
No. So systems are automatically detecting problems. Workloads fail over across regions and disaster recovery is tested regularly. It runs like a 24/7 operation, not a once a year chore. In other words, you have optimization, you have automation, you have workflows. You may have some AI thrown in there to do some of this. The DR, disaster recovery and testing, all that stuff's automated and happening constantly. That's high maturity.
Yeah. So that explains. So we're talking about those differences, the low and lower than low. Cold and ice cold. Black Eyed Peas. But the point, I think, just with what we talked about on infrastructure alone, explains why. You remember I said they rated 1 to 10. And so, we would tell people you want to be about a 7, right? That's your goal. Get to 7. Then you can worry about getting better. Because that's, I'm not just doing the bare minimum. I'm not in the middle. I'm above that. Because all businesses should at least be in the middle with what we face today. So I'm going to be a little above that. And that's essentially what we always say. You want to kind of land in the middle of how much I'm spending, how much I'm investing in resources, and how much risk I'm still taking after I've done that. Well, they show on their distribution of the most wired level ratings, they accounted for level 10. So remember, there's all these places. So with that high that you just talked about, doing all of that stuff, there were only 6% that reached level 10.
Wow.
And this is across all of the domains, but I wanted to hit it now so we could kind of make sense of it later. 29% were at level 9. 39% were at level 8. Level 7 was 13%. Okay, that's all great. And then it gets to this part, that 13%, and the next part is where grading, having somebody grade your paper kind of thing. Because it just lumped levels 1 through 6 together. Because you really do want to be that right there, just above minimum, not bare minimum, not just showing that you're trying, but actually successful in doing some of this in maturity. You would be level 7. So 1 through 6 all dumped, and you still get 12%. So double the number that are at level 10. But that's still not too bad, right? So if you're low, I don't think I'd like to point out there is no level 0, David.
It's a -1.
Starts with 1, no 0. So if you are what they consider low maturity, you're using the cloud, you're using the connected.
Can we call them immature? Do we have to say low maturity? Can we just say immature?
Well, if you're below this, you're immature. How about that?
Okay. I can do that.
Yeah, if you're low maturity, you're a teenager. If you're below that, you're what do they call them? A tween. and then high maturity, you're adulting. So there you have it. So it goes back to, though, if we look at the infrastructure piece and we want to have something, you don't have to reach that top high level, but you need to have enough of it that you're not falling into the low, is really what I'm trying to say. So in every situation, everybody be like, so what do I need to do? I can tell you that I cannot make the exact same recommendation to every single site unless they've done nothing. And then that's pretty straightforward.
It's pretty easy right here.
But if you're out there trying, then I can make a different recommendation to everybody on how to get more mature. But it does involve those areas that I mentioned before.
So what you're saying is, if you're not doing anything, don't waste your time taking this. Just you're at the bottom.
Again, there is no level 0. So you're not even on the chart. So anyway, so now that we've hit one of them and we kind of looked at that, let's talk about the rest of them.
All right, cool.
You go with it.
So cybersecurity, of course, I want to know about this one. Low maturity is that you've bought the tools, you have a plan on paper, but you've only tested it annually or after an incident. Now, obviously, that's for those organizations that buy their own tools. But
you bought the tools. If I bought it from you, I'm buying the tools.
Yeah, but you're paying with an MSP. You're buying the tools that come managed. So somebody should be doing all this work.
Okay. Again, in order to have a mature program, I buy the tools from somebody. I don't get to check that box. I need to make sure they're doing the work. How many times do we run into, number of times that I've heard, I pay so-and-so and they need to blah, blah, blah. That means I don't have to worry about this. That is not what that means. I still need to get reports from you and know that you're doing your part. I can't, what is it we always say? I can't outsource the liability. I can outsource what it takes to lower my liability.
Right.
So even though, I'm not buying it myself, I'm buying it from you, but I'm also outsourcing you managing it. So my plan is on paper that you're going to do your job, but if I'm not looking, trouble's cooking.
That's right. All right. High maturity. So you rehearse your incident response like a fire drill, automate threat detection, and report cyber readiness to leadership regularly.
So that's high-end stuff where you got the board engagement and all of those kind of things. And a key piece that this report goes back to is the importance of governance. That's the maturity piece that they say if you don't have the governance, you can't get to those upper levels where you should be. And then people are like, what is governance?
It's the G of GRC.
Yeah. But, a lot of people just talk like, everybody knows what that means and nobody wants to ask, what does it mean? But it's like the laws. It's the rules that your organization works within. And is it structured and organized? And do you, so the written policies and procedures is the government of your company, your organization. So I have written policies and procedures that say, here are the rules. And if I don't follow the rules, these are the consequences. And if something goes wrong, this is who's going to work on it. And they're ready because we got them going, prepared and planning for it. And I've got all of these other people that I bring in to support us in order to do that. Well, okay, that's a mature approach. And I have it all clearly defined. And as a leader, I have to be engaged to understand that that's actually happening. So that's the governance. And that means the leadership involvement.
All right. Let's move on to number 3, supply chain. So low maturity would be the fact that you're managing your supply chain on spreadsheets, manual forecasts, and maybe an occasional vendor check. Like the ones I get. It's like, here, answer this thing about yourself. And I'm like, that's not a vendor assessment if you're asking me to do the assessment of myself. But okay.
I want to look at your answers,
Yeah, I bet you, I'm like, I got a 10 on everything. I'm awesome. See? Now, usually I fill it out and send it back, and they're like, okay, can you explain this to me? Like, I don't understand any of the stuff you put down.
Yeah, that's the flip side. Yeah. But
all right.
Again, if you're not at least doing some of that, yeah. So there you go.
What's always funny is when I say, you never asked me to prove any of this. And they're like, can you prove it?
Yep. That's always my question.
Okay. So high maturity of supply chain would be predictive analytics, automate reordering. So it's not a manual reordering. Vendors are continuously risk scored, and supply, finance, and clinical systems talk to each other in real time. Wow.
Yeah, that's high end stuff.
That's very high end stuff.
But we're not saying get there. We're just saying the low is the 1 through 6. You want to be a little higher than that.
Yep. All right. Administration. This is for finance, HR, revenue cycle. So low maturity would be manual contract management, disconnected workflows, AI pilots that don't scale. I guess that would be like, hey, we started this thing. We sprinkled AI in there, but we don't know what it does now. But you're starting to see at least some words that are coming up over and over again, or things like manual and disconnected. So you're starting to see where anytime you have something that's low maturity, that means it's being handled manually in most cases.
Yes.
So high maturity in the administration side, automated spend analytics, contract lifecycle digitalization, AI tools that deliver measurable improvements in your claims, your denials, your staffing, your flow. It reflects that you've adopted all this automation and you've got the findings that track ROI. So you know it's working and you know it's worth the money you're spending, rather than it's like, who wants AI? Me. What do you want it to do? I don't know. When do you want it? Now.
Exactly. All right. What's next? Oh, my analytics
Your
and data
favorite.
management. Yeah.
Yep. Your favorite one.
So the low maturity is dashboards exist, but data definitions are inconsistent, which is, everybody like, well, just show me a dashboard. Okay. What are you going to do with that? Right.
I'm going to look at it.
It's pretty colors. If the colors look bad, I'm going to say something. If they don't, I'm not. Okay, then I just put a lot of red where I want you to talk about it, right? And AI is deployed without strong validation, which that's the whole session I want to get into about people are just throwing this AI at it and not actually grasping that it's probably not accurate. I mean, the number of times that I get in the argument, we talk about arguing with it, and, you feed the same information to 2 different models, you're going to get 2 different answers. It's not the same. And
AI does not stand for accurate intelligence.
No, it does not. So that's your low maturity. If you're just like, well, I get reports, I don't know what they mean, or this means this over here, but it means something else over there. But then when you're at high maturity, obviously this is like way up there, and you've got enterprise data governance is in place. Data stewards are assigned. Somebody's in charge of tracking data. That is their job. AI is evaluated before and after deployment. That's the key. Is okay, well, look at there, it works. Let's start using it. No, you have to, deploy it, and then you're testing it and you're constantly monitoring it. And then the models are monitored continuously for drift and bias. And this is healthcare is big concern, really, for any of those things happening. The drift and the bias is like you're getting too much data in one direction, creating bias. You started with bias. So everybody's like, what do you mean? Well, it means that, like, for example, I was talking with somebody at the HSCC meeting, and they're like, yeah, you always think that you don't want any bias, you want a broad. And then there's an orthopedic surgeon they worked with that worked only with the Medicare patients. And that surgeon said, I don't want the data that it's making decisions on to include the 25-year-old who is an outdoor enthusiast and rides, does, those triathlete things, and they fell off a cliff when they were climbing a rock free-handed, or whatever, I don't need those impacting my data, because that creates some problems for him. And so you've got to be able to control what data it's using, and the decisions that you're getting out of it are directly related to the data it knows, as well as the algorithms it's using and the things that you're asking it. So you have to worry about all of that in an ongoing basis, because these tools are constantly getting new data that will have them make new decisions. And they'll get an upgrade. The engine will get an upgrade. It'll make new decisions. So that's a big piece of staying on top of data analytics and managing the data, because AI is all about data. So there you go. Next. Where are we going next?
So did, I don't think you talked about the high maturity on that. You just ranted on low.
Oh, I talked about AI evaluated before and after deployment. You have
That's
a
right,
data
you did.
governance
All
in
right.
place, data stewards, people in charge. Did you miss me going through? Were you even here when I did this?
I was asking AI if it knew where we were at. So number 6, interoperability and population health.
Yes. So the low maturity, you can send data out, but it doesn't come back in ways that are helpful for clinicians. And even that process is not built into the workflow to be more helpful. And that's the way that we've been for a long time. You send data out, and then getting that feedback from that data, not very helpful. It improves some things, but in the clinical part of population health, you're really, that's where this matters. And it's really talking about, we have the interoperability information blocking rules that went into place a couple of years ago. And those are really starting to come into play now, which, back then, not, everybody's like, what does this mean? Just don't do it.
Yeah.
If you're on the provider side, the information blocking, not a big thing, but that is what prevents the interoperability. And so they work with the vendors to make it more interoperable. So that's the low, is that you send data out, but you're not really getting it back and using information that's going to help improve care. The high maturity is you have external data flows directly from all of this stuff into your EHR. Your clinicians can trust and use it. That requires people to confirm the data, going back to the previous conversation that David missed.
Mm-hmm.
And longitudinal patient records drive real-time risk and care gap analytics. So you're really now using data and constantly improving the data we're using, monitoring the data we're using, and then able to use it to improve care. And by extension, patient health. So, ready to switch back to you, or you want me to take it from here?
That brings us to number 7, patient engagement. So a low maturity would be the fact that, you have a portal, maybe online scheduling, but nobody measures outcomes or coordinates governance across departments. So there again, you got the tools, not using them properly. High maturity would be engagement tools are embedded within workflows. They're governed by cross-functional committee and tied to measurable reductions in no-shows, better follow-ups, and higher satisfaction. So you're directly aligning your governance and your findings with the outcomes, and you're looking for those gaps so that you can fill those gaps that come up.
Yeah, so you're wanting the patients to be fully engaged and giving them the tools and education they need that makes things better for them.
Right.
Yeah.
Get them to participate, to engage.
Yeah, the ultimate goal. I don't care
Number
about
8,
that.
clinical quality and safety. Low maturity, safety reviews happen after events. Medication scanning is inconsistent and clinical AI lacks oversight. Yes.
Yes.
The high maturity would be closed loop medication administration is standard. BCMA compliance is monitored in real time, and AI driven safety surveillance prevents issues before they occur. All right.
Yeah. So, the big difference here is use the technology to help us. And low maturity, we're not using it really for anything. Unless, oh, crap, something happened and now we got to go back and see what is in the data. Or, oh, look, we're using AI, but nobody knows what it's doing or how it's doing it. 2, having everything fully integrated and somebody's on top of it. So, it's like the thing years ago. I remember when they started changing things, like when you go to the health system and stuff, and they walk in and they're going to, do, check your blood pressure, all of that stuff. Doesn't matter what it is, whether you're going to the lab to get blood work, whatever. Somebody new walks into the hospital room to deal with a patient. Every one of them is like, tell me your name and your date of birth, so that I can confirm you are you, instead of getting, risking having anything happen to cross up what patient records should be pointing to who. So those are the kind of things that we're going to see more and more. And hopefully, well, I don't know. Let's say they get those wearables with the glasses where the doctor walks into the room and it looks at your face and pops up all of the records right in front of them because it knows your face. That gives me the heebie-jeebies. I'm just saying.
Yeah, because you could be like, what are you looking at?
Yeah. Okay, which then is a perfect segue to number 9.
Yeah, number 9, innovation and emerging technology. Because, there are some people that just, and I'm one of them, like I gravitate toward technology and I just want it. It don't matter what it does. I just want it. So low maturity would be you have like these random pilot programs. You don't have any kind of ROI tracking happening. It's just, you're just putting on a show for innovation's sake. Cool projects, no plans. Let's just put it out there. And this is how a lot of people have really treated AI. Like, we got to have AI because somebody says we have to have it. Because if we don't have it, we'll die. We've heard that.
Yeah.
So high maturity would be that, innovation is governed like a portfolio. It's evaluated consistently. It's tied to a strategy. It's supported by processes that validate AI and emerging tools before deployment. So, yeah, your program is mature. You have a validation by using frameworks. There's tons of them. We talk about them all the time.
So that is a big thing. It's just this random cool project. I just saw something. And those are the ones when they go to the conference and then they come back and they've bought something. And you're always like, please. That's
I saw this new tool.
Or they love it. They come back. They take the card and give it to somebody in the office, and you're the poor soul that calls them up and says, so-and-so love this. And they're like, no, they didn't. Blah, blah, blah. We don't want this. And you get ripped a new one because they set you up for that. So, I mean, there's a wide variety of things that happen, but the cool thing are, they go to a meeting somewhere in town and another doctor's telling them about something they're doing. We run into those kind of things all the time. And you can't just start doing things anymore. Like, people would start doing them and they could abandon them. You start throwing AI in there, it's hard to abandon it because you're getting all that data. You got to worry about where the data's going. You got to worry about what is it doing with the data and all these other things. You can't be loosey-goosey with the rules anymore. So
yeah,
it's huge. And
it is. All right. There's the 9 of them.
Yeah. So we kind of went through all of those areas. Apply to everybody pretty much. How you're doing it, what you're doing, it all applies.
Yeah. And if you're not in healthcare, you just, instead of patient engagement, you just say, what about customer engagement?
Yeah. I think if people used it, the intent that they, gave it was they wanted people to use this to make data-driven decisions, which is what I always say I want. I want data-driven decisions. And the more data you have isn't always the best, because sometimes it's not, like when AI answers you, sometimes it's giving you way more information than you want.
Mm-hmm.
But the whole point is this gives you at least some insights, and obviously there's a link to all the stuff. But it gives you something where you can start asking this question on your own. You don't need somebody else to, you can go download the survey and see how they got, what the questions they were, and just kind of look at where you stand, knowing where the output was. But if you're sitting back and waiting, and I always hate to hear this, well, I'm going to get through the end of the year, and then, I'm going to get past this, and then, I got to get this done, and there's always going to be a conflicting priority.
Mm-hmm.
That's the nature of the beast. So you just got to cut and run. Just, don't do it. Pick one and stick with it. But this at least helps you make those decisions. So there you have it. Now I'm all done.
All right. So now the only question you really have to ask yourself is, are you mature?
Yeah. Digital adulting is hard. It's hard work.
It is hard. Yeah, it is. You'll find that it's probably a little bit harder than real adulting.
I think so. I don't think you're wrong there.
All right, folks. That's our show for today. Thanks for listening. Be sure to share this out. We appreciate it. Be sure to join us next time. Remember, for Donna and myself, the HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.